Hello friends, welcome back to our YouTube channel. Myself Dr. Shardul Joshi, and we are in this series we are discussing how to understand different materia medica. What are the strength of different materia medica? So far we have discussed about Kent's materia medica, Fatak's materia medica, right? And while discussing about the Fatak's materia medica, we have discussed that Fatak was the follower of Dr. Boger. So today let's discuss about the Boger's Materia Medica. And you can see what is the name of Boger's Materia Medica? Synoptic key of Materia Medica. And why would somebody keep the name of book as a synoptic key? Friends, Shakespeare says what is there in the name, right? But it is not always true. When Boger skips the name of the book synoptic, he must have some intention. Okay, so let's try to understand what is the meaning of synoptic, and if you understand what is the meaning of synoptic, it will be easy to understand Boger's Materia Medica. Okay, so let's see what is the meaning of synoptic. Synoptic means general view of the whole, or summary, in short we can say. It is the short description of a big anything, big area, or big text, or big description about medicine. So it is the short description, the thing in given in nutshell. And if you understand this summary, if you understand this in nutshell, you will get the key to unlock the simillimum of the case. So that's why he has called his book as a synoptic key. Okay. So who was the Boger? So Boger was German from origin. He used to practice in America, and he was the master prescriber, having huge practice. He wanted to write so many books, but because of huge number of patient practice, he could not able to do that. He was the ardent follower of Boning Hussein. He translated Boning Hussein's repertory in English in 1905. So he got influenced by Boning Hussein and carried forward his ideas. Okay. So this book contains three parts. First part is repertory. Second part is Materia Medica. And in third part, he has given duration of remedies, relationships, and regional repertory. But today we are going to focus only on the Materia Medica part, the synthetic key. Okay, the synthetic part. So if you want to understand this book, what is the strength, how to read, how to understand, we should go and read the forward to this book. What Boger has given in forward, why he written this book, what was his intention. So in forward he start with his concept of totality, and this concept will be reflected, you see, in the structure of his book, how he has given the Materia Medica. Okay. So in the concept of totality, Boger has given immense importance to the modalities, and especially the causative modalities. So Boger says if you get the causative modality, you will get the case. Okay. Then he gives importance to mental symptom, sensation, specific sensation, observations, and one of the most important part of Boger's Materia Medica is part affected, or the drug affinity, sphere of action. He gives lot of importance, which part, which side, okay, knee joint is affected, which side of right sided knee joint is affected. So he would consider in his totality. Okay. So in detail he gives that also. So let's see the structure of Materia Medica. Okay. So on the screen you can see example of China, Cinchona officinalis, one of the important remedies from our Materia Medica. So he starts with the region. So region means part affected, or the drug affinity, sphere of action of that remedy. So if you read in detail, he gives, whenever you want to study or want to refer or want to see what is the action of this remedy, please open Boger. You will get the detailed sphere of action in Boger. So here he writes action of China is on blood, circulation, secretion, In that he gives secretions of digestive organs, liver, then he gives action on spleen and nerves. Okay, so he gives the sphere of action. After that he talks about the modalities, worse and better. So in important modalities he would give in capital letters. So always remember, the capital letter words modalities are most important. After that he gives the general expression or the synthetic or the information, the main part of remedy. Okay, followed by few mental symptoms and then particulars from head to toe, and ends with the relationship of remedy. Okay, so this is the structure of Materia Medica of Boger. This is how he gives every remedy, starting with the drug affinity, then modalities, then general expression, and mind symptom, followed by head to toe particulars. Okay, so let's go to the most important part of Boger's Materia Medica. When you read forward further, he gives the concept of genius of remedy. And friends, please listen carefully. This is the most important part of Boger's Materia Medica. What is genius of remedy? And he coined this term, and what he says about, let's read. Okay, what he says: the strain, listen carefully, the strain which runs through every pathogenetic symptom complex has been called the genius of the drug. What is genius? A strain which runs through every symptom complex. It is the common thread, it is the common entity, it is the common phenomenon which will be present in all symptom complexes, whatever it may be: respiratory system symptoms, GIT symptoms, joint symptoms, mind symptoms, generalities. The same phenomenon, the same expression you will get everywhere. And this is called as the genius. And if you get this, you will get the key to unlock the case. You will get the key to the simillimum. Okay, and what he says further: to give this its proper place, this means genius, to give this its proper place is in the prescription should be the ideal of every prescriber. So we should strive to find the genius in every case, in every remedy. And if we study the Materia Medica, if we study the genius of every remedy, or at least the main remedies, the main polycrest remedies from our Materia Medica, friends, there will be no problem in your practice, right? Definitely you will succeed in your practice. Okay, so we'll try to understand how and where he has written this genius of the remedy in his book. So again we'll see the example of China. So what is the genius of remedy? So if you see this highlighted part of the remedy, okay, so he starts with the region, that is drug affinity, then modalities, and after modalities he gives first few lines. So first few lines of every remedy would be the genius of remedy. So let's try to understand genius of China. What he writes: intermittency, that means symptoms should be intermittent, there has to be periodicity, it should come in certain intervals. So periodicity or intermittency is very important. Then profuse exhausting discharges, hemorrhages, etc. Okay, so this is very important. In Phatak also we have seen that Phatak writes etc. Okay, so we'll try to understand what he says, what he meant, what to say here. So what is the genius? Profuse exhausting discharges. So whatever may be the discharges, vomiting, diarrhea, nasal discharges, urine, hemorrhages, has to be profuse and exhausting. Okay, so that is the meaning of this etc. He has given only one example: profuse exhausting hemorrhages or diarrhea or vomiting or perspiration or urine or nasal discharge. Has to be profuse and exhausting. Person should get exhausted, weak, prostrated after this profuse discharge. So same thing you will see in the modalities: vital losses. Okay, so weakness coming after prostration, exhaustion coming after losing discharges. So there has to be loss of vital fluids. Okay, is one of the most important criteria for prescription of China. Okay, further what he says, weak, oversensitive and nervous. Because of this exhausting discharges, how person becomes weak, prostrated, exhausted and very sensitive, oversensitive, and oversensitive to everything. Okay, everything upsets him: light, noise, odors, pain, etc. Again etc. Etc means everything. Everything around him can upset him, can disturb him. Noise, pain, change of weather, temperature, draft of air, everything will affect him. Then further he writes, hard swellings, bursting, rheumatism, neuralgia, emaciation, anemia and dropsy. Right? After that there are dot 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 dot. So dotted line is there. That means the genius ends here, and after this dotted line the mind symptom starts. So after the modalities and before the dotted line, whatever he has written is the genius of the remedy, general expression. And if you are able to understand, if you are able to grasp this, you will able to master that remedy. You are able to find that remedy in your practice. So in order to prescribe China, there has to be periodicity, there has to be profuse exhausting discharges, there has to be history of loss of vital fluids, and because of that person becomes weak, nervous or sensitive. This is the genius of China. This is the genius to prescribe this remedy, and this is the strength of Boger's Materia Medica. Okay, so why we should read this book? First, to get the exact sphere of action of the remedy, drug affinity, and second, to understand genius, or he called is as the general expression of the remedy, to prescribe exactly. So this is for today's video, friends. If you want to get such informative educational videos, please subscribe to our channel. Keep learning, keep growing. Next video will come with the next Materia Medica. Thank you.